Hi, you guys. Welcome back for our daily practice questions. It is day 172 and our Pharm series continues. But as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it's free and linked in the description. My website is also linked in the description, and it houses all of my resources and is broken down for first-time test takers as well as those who may be retesting. All right, you guys, let's get into question number 1. It states a 70-year-old patient presents with chronic bilateral knee pain, stiffness lasting less than 30 minutes in the morning, and crepitus on exam. What is the first line treatment? Is it A, methotrexate? Is it B, NSAIDs and physical therapy? Is it C, systemic corticosteroids? Or is it D, hydroxychloroquine? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first so that you can determine what is actually being asked and make sure that you're answering what is truly being asked of you. So here, the stem of the question states, what is the first line treatment? You know what I always tell you, if they're looking for a treatment, you got to run it back and see if they even provided you with a diagnosis. If there has not been a diagnosis provided, you need to run it back a step further and look at the assessment findings so that you can determine a diagnosis, because we got to know what it is to be able to treat it. So a diagnosis has not been provided, so let's check out the assessment findings. So we have a 70-year-old patient that comes in with chronic bilateral knee pain and stiffness lasting less than 30 minutes in the morning and crepitus on exam. All right, that stiffness lasting less than 30 minutes in the morning is letting you know that this is, and also with it being bilateral, is chronic, and there's crepitus noted on exam. I want you to think otitis, not otitis, y'all. Osteoarthritis. I'm combining the two words. I want you to think OA, osteoarthritis, right? And with OA, we typically want you to do things like weight loss, physical therapy, things of that nature to aid in the pain. And then NSAIDs can also be utilized for symptomatic management. So for first line treatment, your best answer here is B, like your NSAIDs and your physical therapy, okay? Question number 2. A 40-year-old female is diagnosed with rheumatoid arthritis. She has joint pain, prolonged morning stiffness, and positive RF and anti-CCP. What is the most appropriate initial DMARD? Is it A, hydroxychloroquine? Is it B, sulfasalazine? Is it C, methotrexate? Or is it D, etanercept? Y'all know that I really go on a limb to try to teach you these things because I don't know what it is, but arthritis medications tear me up, okay? But I'm doing this for y'all. You got to thank me for something. I'm struggling for y'all. But anyway, seriously, tell me what you got in the comments. Which one do you think? All right, stem of the question. What is the most appropriate initial DMARD? So yes, we're talking treatment. Yes, a diagnosis has been provided. It's RA. We have rheumatoid arthritis. And so you can also look here as a key description. It says prolonged morning stiffness. Remember question number 1, they had morning stiffness that was less than 30 minutes. That's a key identifier and differentiating factor for OA versus RA. So pay attention to that when you see that in descriptions, okay? Or even when in practice, when the patient is explaining their symptoms to you. These are key identifiers. But anyway, it is looking for the most appropriate initial DMARD for rheumatoid arthritis, and the best answer is C, methotrexate. And lastly, question number 3. A patient on methotrexate for RA needs monitoring and adjunct therapy. Which of the following should be included? Is it A, a liver function test and folic acid supplementation? Is it B, an annual TB testing and vitamin D? Is it C, bone scans every 3 months? Or is it D, a TSH monitoring and calcium? Take a moment and tell me what you got. All right. STEM of the question states, which of the following should be included? So in scenarios like this, that STEM is really not giving us enough, right? So let's see what's going on. It says a patient on methotrexate for rheumatoid arthritis needs monitoring and adjunct therapy. So which of the following should be included? So what other types of monitoring and adjunct therapy should be included for a patient on methotrexate? And your best answer is A, your liver function test and folic acid supplementation. And I'm going to tell you why. Because methotrexate can cause hepatotoxicity and folate deficiency. So we want to continuously monitor their LFTs to monitor their liver function, as well as going ahead and implementing and putting them on folic acid so they're not having that deficiency. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursinstudio1@gmail.com. Now, all of the resources that I offer are linked in the bio of this channel, including my website. And my website is also linked in the description of this video. As I mentioned earlier, it houses all of my resources so that you're able to navigate and see which works best for your scenario. If you're a first-time test taker or if you're retesting, all of the resources are included there to guide you to exam success. But y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.